Teledentistry, what is it? Go to teledentistry.operadds.com to find out how you can completely change how we bring in new patients, giving them the ability to send photos and video before you ever talk to them. Go to teledentistry.operadds.com. Welcome to the Operatory, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is the dancing man, David Pryor. How are you doing, man?
Good, Brian. How are you today?
I'm doing well.
I try to break you today, and it's not been going my way.
Yeah, I'm mellow today.
Ugh.
I had a cupping massage where they I'm gonna have big purple circles on my back. It's amazing.
You should really do that during the summer, because when you take your shirt off at the beach, it's not going to look super weird.
Yeah,
wait,
looks like I was attacked by an octopus.
Yes,
but it's amazing. For dentists out there who have hand issues, try the cupping massage. It's transformative. It's amazing. If you have chronic issues, man, it's great.
I'll just stick to my Red Bull.
Oh man, that's like beyond Mountain Dew. It's like taking Mountain Dew, distilling it down to the nastiness, and like adding a little dash of gasoline, and you got that.
To its core deliciousness? Yes, I agree, Brian. You're right.
No. It's bad. It's bad. But today I want to talk about how sales in dentistry. Like people, it's a bad word. You don't say sales. So you can call it what you want: case acceptance, treatment planning, talking to patients, how we get people to say yes to dentistry. And so it's the number one thing that I think you need to instill in your practice to its core to drive patients to say yes. When we're in our practices, we're working with our teams, right? We want people to just do what we say, right? If I say you need to have a crown, I don't want to hear you. But we get denied every single day. I like to say that, like, especially being a hygienist, it's like having a job in rejection. Like nobody wants to do what we tell them to do, right?
Yeah.
Yeah. And so we have to break through that. We have to like get people as excited as we are to elevate their oral care. Make sense?
It absolutely makes sense.
So you're looking at me because usually I ask you, even though you do a great job providing the patient experience, I usually use you as a sounding board, Dave, and say, hey, Dave, what is it? So what do you think, because you come in here the blank slate, right?
Yes.
You don't know what we're talking about.
No.
And I'm talking about sales today.
Yes.
So what do you think is the number one thing to drive sales, to get people to say yes? It's not, if sales is a naughty word for you in dentistry, think of case acceptance. What is the number one thing we can do in our offices to help people get the oral care they need?
Trust, Brian?
Trust is a piece of it. I'm going to call it confidence.
Okay.
I think
it's the same thing. We're saying the same thing.
Yes.
Yes.
Trust, confidence, enthusiasm,
Yep.
right?
Yep.
It all comes down to having people. If you enthusiastically let people know what is in their best interest,
Yes.
they will more than likely go, oh, I agree. Right?
Yes.
Because let's face it, patients can't diagnose their own dental conditions. They have to rely on us. And so they're relying on us to confidently be able to say to them what is in their best interest. And so we're going to talk today, Dave, about how to instill confidence in your team and in your patients, so that when you go to the practice and you're talking, and you can see, all these great things we can do in dentistry today. We can do clear aligners and implants and CAD restorations, all the stuff, you slap a VR headset on and get all sorts of work done. So, but we still have to get patients to have confidence in us, the trust in us, the confidence in us,
Yes.
to go and say, yes, not only do I believe that this is dental care that I need to have done, even though I can't feel it, because most of the time they can't,
Right.
but you are the people that I want to have perform the dental care on me. So you probably know the answer to this one. How do we instill the confidence into patients? It's through our communication.
Okay.
Right?
Yeah.
You've been on the other side of this, right?
Yes. So are you talking about me and my experience in the dental chair?
Sure.
Okay.
Sure.
So I have a unique insight into this in your particular practice, because when Bryan and I first met, actually, Bryan was working as a sales rep in a company that I was working with, and
Selling computers. Because we're nerds.
Yes, and so selling technology, as he continues doing today. But what
With a big break to fix teeth.
with a big break to fix teeth, and so you were super successful back then, and this is 25 years ago, and it the same message rings true.
Absolutely. It's all confidence.
Right. And so you would confidently deliver the answer of here's what you need in order to be successful in what we're trying to accomplish, right? And so when you have a patient in the chair, it's the same thing. You're doing the same thing in the dental chair as you did when we were selling computers, which is confidently telling the person this is what you need to do in order to achieve your goal, in this case, dentistry.
Except it's easier now. You know why?
Because you have a diploma on the wall?
No.
Okay.
That didn't make it easier. Probably made it harder, actually, because then it's like, oh, it's just the dentist, right? Because people don't look at the computer sales. Well, it's probably very similar.
Yes.
Same level of respect. No, it's not. But because I have a team, right? So you have an unfair advantage. Because you've got a team, and we must leverage our team. Because here's what you don't want to have happen. I walk in the room and I say, hey, Sally, wonderful hygienist, how's everything going in here? Everything's fine. Guess what? If everything's fine, and then I see something, everything's not fine. Because guess what the patient thinks? There's a disconnect. Right. Sally doesn't see something that he sees. Who am I going to believe? Probably the person that doesn't see it, right? And so we need to flip it around. And so it requires very smooth intra-office communication. And I've said it before, I think intra-office communication is the most undervalued thing we do in dentistry. Communication between team members. You need to walk in, have the hygienist have already told the patient, I think Dr. Pryor is going to recommend a crown on this tooth. And so we'll see what he thinks. And when you come in, you say, I completely agree. That's all you have to say. Mm-hmm. You don't have to even be confident about it, because she was confident about it. You can say your confidence should be in your hygienist who's actually informed the patient. Then how is the patient going to say no if you guys are on the same page and you confidently are backing each other up?
Well, you've just provided your own second opinion.
Yeah, exactly.
Right.
But it's not a second opinion, because you guys can get on the same page. It's through a process that I like to call calibration, right? So, and the way you do that is before you walk in the room, the hygienist says what they think you'll say. Then when you walk in, if there's a difference, you politely, the first thing, you don't want to negate everything the hygienist said, because you'll undermine their authority, you'll make them feel bad, and then guess what? They'll never tee up anything ever again. Right. So always stand behind your hygienist. It's great when you can be more conservative than the hygienist, because you look like the superhero at that point. A big thing is to make sure you don't feed that rejection to the hygiene team as you're doing this. Right. But then when the patient leaves, then have a little powwow on what you're seeing, and if there's a difference what the hygienist was seeing, talk about those differences. The bigger the difference, the bigger the learning experience. And then after you do that for probably 2 weeks, you'll see things the same way, because or else you'll understand where the differences lie.
Well, and I find that to be the case in a lot of dentistry, which is really unique. The dance among the different disciplines, the hygiene and the assistant and the doctor and the front desk, and all these people have a different role to play. But if they're all working towards the same goal, if everybody starts to get a level of ESP, a level of understanding of what the other person in the other role is going to do, then it makes it a much smoother experience for not just everybody in the office, but the patient as well.
Yeah, exactly. And we've talked about it before on the podcast, because it was the first issue that we tried to address using chat from OpperDDS. Yeah. But I wanted to revisit it through the lens of instilling confidence, because I do think that that's really what it's about, is trust and confidence in your team, then the trust and confidence from the patient to you. It's all about communication, and it really gets undervalued. 1/3 of all medical mistakes are due to miscommunications.
Yep.
But ultimately, what I see, it's still pervasive in the industry. It's something like paper. It's like a piece of paper on a clipboard that needs to go. We can't just walk in and ask the hygienist how are things going and expect people to have confidence in our care. It just isn't acceptable today.
Right.
You have to know what you're walking into. You want to get that information before you walk in the room, and then that will give you the confidence to be on the same page with the hygienist. And after a couple of weeks, that's when things move like clockwork. When you're instilling, and then you do have confidence in your team because you're on the same page. And when you walk in, that'll exude to the patient, and that's what causes patients to just go, "This is the place," and they know what they're doing. And this is where I want to get my care done.
It really steps up that level of professionalism. From my chair, when everybody is in concert, it steps up that level of professionalism, and then I know that I'm getting exactly what I came for, which is accurate dental care.
Okay, well, and so you used a different word than I use. I'm saying confidence. You're saying professionalism.
Yeah.
And so that's an important distinction because I don't know what you mean when you say professionalism. Maybe
Obviously.
because I've got a big picture of the Millennium Falcon on my wall, and so you saying to me that I have professionalism. I'm going, what am I doing? Well, what does this mean to you, man?
Because, and you're getting caught up in your own trap, because what happens is you create this great communications tool, and you're saying it's confidence, but from the patient side of things, confidence is professionalism. And so that's what we look at. We look to you as the dentist, as the caregiver, saying, are you sure?
I love it. I love this. I love your patient. Your perspective is always, this is key. Because in my office, I've never worn a tie, right? I oftentimes don't shave, right?
Yeah.
I'm known by a lot of my patients that on Tuesday we have bad jokes, and they ask about the bad jokes. So from a lot of people's perspective, professionalism it's not super high. I mean, I conduct myself in a professional manner, but I don't go overboard. For me, professionalism is not about like wearing a super starched shirt and that kind of thing. It is more about how you work together as a team. I've never thought about it that way.
Yeah.
But that is more important. It's like cleanliness is more about removing clutter, right?
Sure.
I
wouldn't know, but yeah, I guess.
Yes. Well, step 1, Dave. Step 2 is like getting rid of the vermin, right? Yes. Oh man, yeah, no, but I guess because there's studies that show that patients view cleanliness as like if you have a bunch of clutter at the front desk, they view the back as unsanitary.
Sure.
Does that make sense?
Absolutely.
So it's very similar. The patients view people that work together in harmony, having without friction, as that professional. Right?
So to back up what you're saying, I certainly as a patient don't look at the fact that you don't wear a tie as the denominator for professionalism. I look at you coming in confidently knowing what I need to do next in order to, save a tooth, save my smile, whatever the case may be. It's knowing what I need to do, explaining it to me, setting up the time. Like here, this is what I've found. Here's the next step. I'd like to get it scheduled today. Let's do, and so take those steps and tell me this is what we're going to do. Now, then from your side of things, if the patient pushes back, then you readdress what parts don't you understand. I mean, it's being confident that you're doing the right thing. And I've never felt in your office that I was being pushed into something that wasn't necessary. It wasn't even it's never crossed my mind.
It has to be authentic,
right?
Or humans can whiff BS
Yeah.
very easily. So
Yeah.
it has to be authentic.
Oh.
Right?
Salespeople can sniff it
Yeah.
way
So,
higher than anyone else.
This is not about treatment planning things that don't need to be done.
Right.
This is about getting people to actually say yes to treatment that they need,
Yep.
right? What's in their own best interest, which sometimes is very difficult. And so we do that by, there's a slight buzz on my wrist. I flip it over. I know exactly what was discussed through Opera DDS in the room. And the average office gets a 30% increase in production when they incorporate Opera DDS chat because of the confidence that it instills in patients to say yes and the efficiencies in workflow that you can do from those minute-to-minute, second-to-second decisions. Should I finish this root canal before I do the exam or not? It's just transformative. But I love your through the lens of professionalism. I think that's especially because it's one of the things that I've been thinking about. I was watching something by Tim Ferriss the other day, and he's wearing an untucked shirt and jeans and but I was thinking about this because he's viewed as like a titan of of industry, and Steve Jobs would always wear jeans and a turtleneck.
Yep.
And Zuckerberg always wears a hoodie, and that's the new professionalism. Well, it's not about the clothes. It's about the confidence that they're exuding, right?
Right.
And because they know what they're talking about, and they don't mess around. They come in, they say it, clear, simple. And that's what we need to do. And the way to do that is through Opera DDS chat.
Yeah.
So to find out more, go to operadds.com.
Thanks, Bryan.
Thank you. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.